This is Dr. Rani Banik and welcome to EnVision Health, my video series where I share my best tips on how to protect, preserve, or perhaps even restore your vision. In today's episode, I'm going to be talking about floaters. Now, most of you have probably experienced floaters, and what they are tiny little lines or squiggles or dots which float around in your vision, and they actually float with your eyes. So if you look in different directions, they do move as your eyes move. And actually, the majority of the population develops floaters sometime in their lifetimes. Most often, it happens as people get older, but can also happen in younger people, especially people who are nearsighted. And the reason why people see floaters is because the jelly in the back of the eye, which helps to keep the shape of the eye, is normally firm like jello. But as we get older, or if our eye is nearsighted, it's a little bit longer than normal, then that jelly can break down into a liquid form. And when that jelly liquefies, then we can see little pieces of collagen or collagen fibers or tendrils floating around in our vision, and those are what we see as floaters. Now, sometimes people have floaters and they're chronic and they're really nothing to worry about, but if you have a new onset of floaters, particularly if the floaters are associated with little flashing lights like a strobe light in your vision, then definitely make sure to go see your eye doctor and have a full dilated exam. And the reason is because new floaters, especially associated with flashes, may potentially signify a retinal problem, such as a retinal tear or even a retinal detachment. So absolutely, definitely get it checked out. Sometimes people experience a floater that actually looks circular, like a C shape or perfectly round, and that floater floats around right in the center of your vision. Now that is a specific kind of floater. It develops when the jelly in the back of the eye, right in the middle where it's attached to the optic nerve, actually detaches. So what you're seeing is the outline of where that jelly was attached to the back of the eye. Now that in itself really does require, if it's a new symptom, it really does require a full eye exam, because occasionally when the jelly pulls off, it can actually pull a hole or tear in the retina and lead to a retinal detachment with significant vision loss. So if you experience anything like that, be sure to be evaluated and have a dilated exam as soon as possible. I would say try to get in to see an eye doctor within 24 hours. So a question I oftentimes get from my patients is, Dr. Banik, I have all these floaters, what can I do to get rid of them? And so there have been different types of treatments that have been used for floaters. Unfortunately, there's no drops that will dissolve a floater. I wish there were, but because I have floaters myself, but it doesn't exist yet. There's no specific pill or medicine you can take that will help the floater dissolve. But there are some procedures that can be done to try to reduce or eliminate the floaters. One procedure which has been gaining popularity within the field of ophthalmology is a laser to try to break up the floaters. But in many cases, what it actually does is the laser can break up a large clump of floaters, but it can actually break it into many, many smaller floaters. So that may actually make things worse, because instead of having a large single floater or couple of large floaters, you end up with many, many little floaters. There is also a surgery that can be done called a vitrectomy, which basically is to remove the jelly from the back of the eye, to remove it completely. And when you remove the jelly, you also remove all the floaters. Now, you may think that that would be an ideal procedure to get rid of floaters, but in fact, it's associated with potential complications, which may end up being worse than what the initial symptoms were. So even though vitrectomies can be done for severe floaters, it's not typical standard of care. Most ophthalmologists would not recommend getting a vitrectomy for floaters. So just know your options and really discuss with your ophthalmologist what the best option is for you. So that's all I have about floaters and flashes today. And I hope you enjoyed this episode. I hope you learned something useful. And if you have any questions or if you have specific comments about this video, please feel free to post it in my Facebook group called EnVision Health. And also, you feel free to post any other questions you have that I can address in future episodes. So thank you so much for listening, and I look forward to seeing you next time.